Hey guys, Dr. Daniel here, Rimrock Wellness Center. We've been fielding a lot of calls trying to help people do some self-care at home because we're in this shutdown. So I want to go over a few tips and pointers that you can do to help yourself at home. None of this is going to replace an adjustment, but a lot of times this can really help you get by. So I'm going to go over a couple things. First, we're going to start with the low back. So if you feel like your hips are out of alignment, your low back's in pain, you're feeling achy, tight, spasm, this may be able to help you out. In the low back, you have your pelvic bones here. Sometimes they can kind of get jarred up or down and twist the pelvis. Sometimes the sacrum bone can rotate this way. Sometimes these lumbars can rotate left and right. One thing that we want to address is these pelvic bones. So an easy way that you can do that at home is you can lie on your back on a table. And you can do this little stretch right here. So what you're going to do is you're going to pull up under one knee as you pull your leg down, and the other knee you're going to push down as you pull it up. You're going to hold that for about 5 seconds, and you're going to switch and do the opposite for 5 seconds. And you'll do that 5 times. Once you've done that, then you can take a foam roller, a medicine ball, and hold it between your knees and squeeze your knees together. A lot of times that can help naturally resolve any pelvic issue that you have if it's a minor issue. Another thing that could come to play is the low back musculature and the psoas muscles. So a good stretch that you can do is just to kind of lay on your side and let your leg hang off the chair, table, bench, whatever you're using, just to kind of stretch and decompress your low back. And then you can switch and go the other direction. And then follow it up with a stretch right here. And then you can also throw this stretch in there as well. This will get the glutes really nicely. You just cross your leg over, reach through, and pull that knee towards you. You feel a good stretch there. And then, of course, stretching out the hamstrings as well can help out. For the psoas muscle, that muscle attaches on the lower lumbar vertebra and wraps all the way down through your groin and attaches down here on your leg. So it's going to come right through here. It can get strained easily and cause a lot of low back pain. It's hard to pinpoint. So you can do some self-massage into that muscle. And you can also do a stretch for that. So I'm going to show you the stretch. So the stretch looks like this. You take a knee, and you want to sink your pelvis down towards the floor and make sure that you're not out here rounded, but that your glutes are contracted to create stretch on that psoas muscle. And then from here, you want to reach up and across. Now, if you want to add to that, simply do this on a chair or a bench, and you can get deeper into that stretch to really stretch out that psoas muscle. And you can do that on both sides. Then you can also do self-massage or have somebody else work for you. Typically, it's going to look like this. Psoas is going to be in this area. Sometimes it's easier to bend your knee. And then you go right underneath your lowest rib, kind of behind the intestines here. Scoot those over, and then push down into the psoas. If you find a really tight spot, then that's probably a little spasm muscle or trigger point in the psoas muscle that you need to work out. Usually it just goes down to about the level of the belt, maybe a little bit lower. So you can work that out. Self-massage, somebody else massage that for you. Or you can use something at home, like a hand weight. It's got a nice edge to it. You can use a kettlebell, can of beans if you have to. So you're just gonna lay into that edge to get that muscle really stretched out and kind of self-massage that. And you're gonna come here and you can kind of come up like this to get that stretch, and then just breathe into it. And you can do both sides. So that's for the low back. So now we'll move up to the mid back. In the mid back, a lot of people at home can get like what they call a rib out, and that's where you strain a muscle around your rib cage here. Oftentimes you can strain the intercostal muscles between the ribs, and you'll feel a sharp pinpoint pain next to the spine, especially if you breathe in really deep or cough or sneeze and it hurts a little bit. That's probably a rib that's out. It can sometimes also cause pain where the rib attaches in the front here or at the sternum. So one way to work on getting your ribs to open up and feel a little bit better is doing some foam rolling. So I just like to put the foam roller on the floor, feet flat on the floor, gently raise my pelvis off the floor, cross my arms, and roll it out. I'm going to do 3 different positions. Once I get to this position, I like to do a squeeze here where it feels tight. And then I like to stretch out here. For your neck, you can then just roll down and relax on the floor, and then push up on your jaw to get a nice little traction on the neck. For traction on the neck, you can also use a little device like this. You take the wedge, and you're going to put it underneath your neck. Kind of where that big bump is at the bottom of your neck is a good place to do it, and just kind of stretch out here. Or you can kind of put it at the top of your neck. If these muscles underneath your skull are really tight, you can kind of stretch those out here. I'd recommend, 5 minutes of this. Don't go longer than 10 minutes. It could be too much, especially if you're in pain. Start with about 2 minutes. One final thing I want to touch on is, let's say that you are in severe pain with your pelvis. You fell, you injured it, it feels out, it feels spasmed. First of all, in those situations, you want to tend towards using ice rather than heat. That's to help get the inflammation down, to help that to heal a little bit faster. Another little trick you can do at home, if you've ever seen me use wedges in the office, you want to get a nice flat surface. Now there are ways that we determine how to put the wedges in, but the safest way that you can do this at home is just to find a position that feels comfortable. If putting the wedge under your hips makes it feel comfortable, then it's probably going to be good for you. If anything increases the pain or makes you feel more uncomfortable, then just stay away from it. You should find just a position of relief, and then you can ice in that position as well. So you can do this on your stomach or on your back. I'll show you on the stomach first. So it's going to look like this. You may have to find different combinations of what makes your pelvis feel good. For general low back complaints, generally both wedges angled down feels a little bit better because it opens up your low back. But you can also try different positions. For laying on your back, you may need someone to help you with this, but you can put the wedges in like so, or switch it depending on which way your pelvis is out. Don't try and figure out how to wedge it based upon the way you think your pelvis is out. Just put the wedges in a way that makes you feel more comfortable, and then you can ice in that position. If I were laying on my back, I would probably be icing the front of my SI joints or where my psoas is for maybe 10 minutes max. You don't want to stay on the wedges really more than 10 minutes, okay? So there's your pointers for taking care of yourself at home. We are here limited hours to answer calls to give you guys some advice and things. Just a reminder, we are only open for emergency cases that we deem could be life-threatening or could lead to permanent disability if you're not under some sort of in-house care. So unfortunately, we're limited right now, but if you do have questions, put some comments in under this video. give our office a call, and we'll try and get back to you as soon as we can. So thanks, guys. You guys stay safe and stay healthy.